Hemodialysis Technician Exam 2026-25 Critical questions you must know. Question 1. What is the primary mechanism by which waste products are removed during hemodialysis? Active transport, diffusion, osmosis, filtration. Diffusion is the movement of solutes from an area of higher concentration, blood, to lower concentration, dialysate. Question 2. Ultrafiltration in dialysis refers to the removal of potassium, fluid, water, red blood cells, antibiotics. Ultrafiltration is the process of removing excess fluid using a pressure gradient. Question 3. Which type of vascular access is considered the gold standard due to its longevity and lower infection rate? AV graft, AV fistula, CVC, central venous catheter, midline. AV fistulas, native vein to artery, are the preferred long-term access. Question 4. What is the most common complication a patient experiences during a dialysis treatment? Hypertension, hypotension, seizures, fever. Rapid fluid removal can lead to a drop in blood pressure. Question 5. A technician notes a patient's bruit is missing upon assessment of the fistula. What does this indicate? The fistula is healing. The fistula is likely clotted, thrombosed. The patient is hydrated. Normal finding. A bruit, whooshing sound, and thrill, vibration, must be present for a patent fistula. Question 6. What is the dialysate? The patient's blood. The fluid used to pull waste and fluid from the blood. A type of medication. The name of the machine. Dialysate is a chemically balanced fluid that runs opposite the blood in the dialyzer. Question 7. Which electrolyte is most dangerously high in a patient with end-stage renal disease, ESRD? Sodium, potassium, calcium, chloride. Hyperkalemia can cause fatal heart arrhythmias. Question 8. What is disequilibrium syndrome? A type of dizziness. A neurological complication caused by rapid removal of urea from the blood. A machine failure. A common skin rash. Rapid dialysis can cause cerebral edema, leading to headaches, nausea, and seizures. Question 9. The AAMI standards primarily regulate what in a dialysis unit? The color of the walls, water quality and dialysate purity, staff uniform colors, parking lot size. Water treatment is critical to prevent patient toxicity. Question 10. What is dry weight in dialysis? The patient's weight without clothes. The target weight at the end of treatment when excess fluid is removed. The weight of the machine. The patient's weight after eating. Reaching dry weight is the goal of fluid removal. Question 11. How often should a dialysis technician check the patient's vital signs during treatment? Every hour. Every 30 minutes. Only at the beginning and end. Every 5 minutes. Regular monitoring is essential to catch hypotension or other issues. Question 12. Which medication is commonly given during dialysis to prevent blood clotting in the circuit? Insulin, heparin, aspirin, Tylenol. Heparin is the standard anticoagulant used in the dialysis circuit. Question 13. What is the purpose of the air detector on the dialysis machine? To cool the blood. To prevent an air embolism from reaching the patient. To measure oxygen. To clean the air in the room. Air in the bloodlines can be fatal if it enters the patient's circulation. Question 14. A Steele syndrome in a fistula patient causes numbness and coldness in the hand distal to the axis, a very strong pulse, headaches, weight gain. Blood is stolen from the hand to the axis, causing ischemia. Question 15. Which needle is the arterial needle in a fistula? The one that returns blood to the patient. The one that pulls blood from the patient to the machine. The smaller needle. The needle in the leg. The arterial line, usually red, takes blood out for cleaning. Question 16. Infection control in dialysis includes which standard practice? Using the same gloves for all patients. Recapping needles. Hand hygiene and PPE for every patient contact. Eating at the station. Dialysis patients are immunocompromised. Strict asepsis is required. Question 17. What is erythropoietin EPO, used for in ESRD patients? To treat high blood pressure. To stimulate red blood cell production and treat anemia. To lower potassium. To clean the machine. The kidneys normally produce EPO. Dialysis patients need synthetic versions. Question 18. Which sign indicates infiltration of a dialysis needle? Pain, swelling, and bruising at the site. The machine running smoothly. The patient falling asleep. Increased blood flow. Infiltration occurs when the needle pierces the vein and fluid enters the tissue. Question 19. What is recirculation in a vascular access? Good blood flow. Cleaned blood mixing with uncleaned blood, reducing efficiency. The machine turning off. Drinking too much water. Recirculation lowers the KT/V adequacy of the treatment. Question 20. The CCHT certification is provided by which organization? NNCC, Nephrology Nursing Certification Commission, BONENT, NNI, ANA. NNCC offers the Certified Clinical Hemodialysis Technician credential.